Hi, I'm Jeff Makowaka with AARP. I'm here at Digital Health Live at CES 2013 with Derek Newell of JIFF. Derek, tell me a little bit about what JIFF does.
JIFF is a platform that allows us to take the best of remote patient monitoring, disease management, social networking and gaming, and combine those in a way that allows large healthcare enterprises to connect to the digital health ecosystem and to engage the consumers that they're working with.
If you had to say, what do you think is the number one problem that is ripe for disruption and to be changed and solved in the healthcare ecosystem?
Today, I think the biggest problem that we have is a cost problem. We have a cost problem that we can't solve. As mentioned today multiple times in this arena, at this conference, we have technology costs driving higher instead of lower, and quality staying the same or going down, but not really going up. So what we need to do is change the pattern from, to measurably lower technology costs and service costs and higher quality and higher throughput and higher output.
So clearly we represent a certain demographic, people over 50. What's integrated into your platform do you think would be especially pertinent to them?
Well, I think a lot of our applications are focused on people who have a chronic condition or who will be developing or who are highly likely to develop a chronic condition, so things like prediabetes, diabetes, hypertension. And so a majority of our population that we're looking at is actually people who would fall into the 50 plus demographic. And so we have several applications, Best Blood Pressure, which is an application that we developed for blood pressure tracking. And we have several more applications which will be coming out in the near future that are specifically targeted to not the 85 plus demographic, but this baby boomer demographic that allow them to effectively manage their health more effectively, connected to their health insurance and connected to the healthcare system in a way that's sort of technologically efficient for everybody.
So let's fast forward, it's 5 years from now, we're standing here at CES. What would be different, would you suggest?
I think in the world of the ecosystem, I think that people would own their data. Like everybody would have a portal that was independent of the healthcare institution, because right now what's happening is all the portals are connected to healthcare institutions, and if you go to two different healthcare institutions that are not sort of legally affiliated or owned by the same entity, you have to go to two different places. So in my world, there's one place where all of my important healthcare data exists for me, and I control it, and I deliver access to it. And if my physician calls me and says I need that MRI, all I do is send him a link, a secure link, and he can get it.
Free the data.
Free the data. Data liquidity. Data liquidity is number one. That would start an innovation revolution like no other in healthcare that we've seen.
Awesome. Great. Well, have a good show.
Yeah. Thank you so much.